We here at North Oaks, we're specially trained in providing breastfeeding care and guidance and support. We offer free private consults. We see all moms in the hospital after delivery and at least once a day. We also help with pumping assistance and breast pump instruction and problem solving. If you would like to meet with me on a personal level or a private consult, you can call me in my office at 985-230-6415, and we can set up an appointment and we can discuss things further. Now we will open it up for questions at this time.
With so many mothers waiting to have children later in life, is there a point when you are too old to breastfeed?
Absolutely not. Breastfeeding is all about supply and demand, so the more the baby nurses, the more milk you're going to make. So no matter if you're 16 or 46, it doesn't matter. It just depends on how often those breasts are being stimulated, and that sends a message to the brain to make more milk. So that has nothing to do with age. No, not at all.
How do you get back into the routine of exercise, losing weight, without experiencing a dip in your supply?
That's a good question. A lot of times, with exercise and getting back into a routine, some moms will notice a slight dip in their supply, and that's kind of normal with excessive sweating. If you're not, replenishing those fluids effectively, always try to drink like a Gatorade, drink 8 or more glasses of water per day, drink some, any kind of fluids that will help provide special nutrients for your body. High protein snacks in between feedings, make sure you're getting enough calories. So we always advise, healthy activity and lifestyle, so that should not have you shouldn't have a problem with decreasing supply.
Okay. Can you explain the difference between foremilk and hindmilk and the importance of each?
Yes, there are 2 parts to the breast milk, the foremilk and the hindmilk, obviously. The foremilk is that first milk that's there. It's mostly water and protein. It kind of quenches the baby's thirst when they first start suckling at the breast. Then on into the feeding, it's not like a light switch where one switches, from the foremilk to the hindmilk. It just is kind of like a gradual process. And the hindmilk is mostly the fatty content of the milk, and it helps baby stool more, stay more satisfied, and that's what helps them gain weight. So it's normal, for the baby to get both parts of the milk, but the longer the feeding, the more of both that they get. So, you don't want to just let the baby feed for short amounts of time on each breast. You want to get that first side really good and empty before switching over to the next side, is what I would say.
Is caffeine consumption safe while breastfeeding? If so, how much is okay?
They do say that a little bit of caffeine is okay. It can cause, the infant to be a little jittery, nervous, kind of agitated. So usually a general rule is like 1 to 2 cups a day. So that should be fine.
I saw that North Oaks is GIFT certified. Can you explain what that means?
GIFT is a Louisiana-based certification that it took us several years to get certified. It's just a gold standard of care that after following their steps, that we were able to provide this for our hospital and provide this for our mothers. So it's basically like the gold standard for breastfeeding and a seal of approval.
How do I prevent sore nipples?
The most important way to prevent sore nipples is a good latch. The best way, a good and deep latch, so the baby is not sitting on the tip of the nipple, causing trauma to the nipple. Getting way far back on the breast with the mouth, open, the tongue down. We like those little lips to be flanged, kind of like a little duck, I always tell moms. And that way they're able to get way far back on the breast and they're not just right on that tip, because they don't get enough milk. That way it's kind of like closing off the end of a straw. But as the baby's more farther back on the breast, they're able to milk the breast more and have a better latch and a better feeding as well.
My daughter is planning on breastfeeding, but she will have to go back to work after a few weeks. How long do you recommend she continue breastfeeding so that the baby has maximum benefit?
Well, the longer the better. The benefits are endless, the longer that you do breastfeed. So going back to work and pumping would be ideal. So usually that's, the best situation. So if she can go back to work, get a good double electric breast pump 8 or more times in a 24-hour period, and that way she can keep her levels high, and she should have enough milk to provide for the baby while she's gone.
What should she look for in a breast pump?
Well, if you're going to be away from the baby, for quite some time during the day, and you're going to be planning on pumping for a while, we like to get like a double electric pump. The higher grade pumps, there's several great brands out there, but looking for a good double electric that provides, good suction, lots of, options as far as vacuum strength, suction speed, that kind of thing. That's what you need to look for. It doesn't necessarily have to be the most expensive one. You just kind of read the reviews and see what works best for you and what's going to benefit you.
I've heard that you can't get pregnant while you're breastfeeding. Is this true?
It's not true. Absolutely not. If you are just solely breastfeeding exclusively, meaning no supplementation at all, you're not missing any feedings, the baby's feeding at least 8 to 10 times in a 24-hour period, you're more likely to be protected from ovulating and that sort of thing and starting your period. However, that does not necessarily mean for sure. It's not 100%, but once the baby starts supplementing, then the chances lessen as far as your protection goes.
Are there any foods I should avoid while breastfeeding? What about alcohol?
There are no foods that you can't have while breastfeeding. Everything in moderation is what the research says. Certainly there are more foods that can kind of increase production, like oatmeal, lots of water, high protein snacks, getting a good, healthy, balanced diet. But as long as you're just having everything in moderation, just like when you were pregnant, continuing on with that, taking your multivitamins, your prenatal vitamins, you should be fine. Alcohol, they usually say, maybe like 1 to 2 glasses of wine or beer, something with less alcohol content is fine, but you need to really probably check with your provider as far as like exact amounts.
Do you recommend co-sleeping or a co-sleeper attached to the bed to assist in breastfeeding for newborns, since it's virtually around the clock?
I think the co-sleepers are great. We do not advise sleeping with your baby because of the increased risk of SIDS, but for convenience, sure, a bassinet by the bed or a co-sleeper, those are great tools, and they're great for moms to get a little bit more sleep and just have access to pick up on those feeding cues from baby, but definitely not sleeping in the bed, just to kind of be protected.
Can I continue breastfeeding if my breast hurt or if I have the cold or the flu?
Yes, you definitely can continue to breastfeed. If your breasts are hurting for some reason, then you need to get checked as far as like what's going on and what the reason is, because breastfeeding really shouldn't hurt. If you have the cold or flu, those babies are the ones that typically don't get sick because of mom's antibodies that she passes along through the breast milk, and you're actually more contagious before you have your symptoms. So you've already probably infected the baby or been, around it more so then. So what we usually tell you is continue definitely nursing the baby. That helps protect them from actually getting it. For sure.
If my baby is in the NICU, can I still breastfeed?
Absolutely. And we encourage that so much here at North Oaks. While you're here in the hospital, if you do choose to breastfeed and your baby does go to the NICU or you are separated from your infant, we will set you up with our hospital grade double electric pump, and we will assist you and provide assistance as you're here and on into even if you're discharged. We have special containers that we collect your milk with, and we send it to the NICU. We have a special refrigerator freezer that's just specifically designed for breast milk. So definitely we encourage it, and it provides so much more for the baby, and we encourage it.
Should I schedule a consult with you prior to my delivery?
Not necessarily. You don't have to, but if you would like to speak to me, some moms want to do like a private consult ahead of time, or just call on the phone, that's totally wonderful. I mean, that's fine. Just give me a call, or you can email me, and we can set up a time and go through some questions that you may have and put some of those fears aside, as well as any questions.
Do some women naturally produce more or less milk than others?
That can happen, yeah. Just some moms, just are bigger producers than some. There are all kinds of factors that can relate to why moms, produce more or less. But you just don't really know until you start breastfeeding just how much you're going to produce and, how much baby's going to need and that kind of thing. So the main thing is just stimulation. It's all about supply and demand. So the more you nurse, the more milk you're going to make. So.
What methods are useful in preventing your baby from nursing so much that he or she overeats to the point of vomiting, even when you limit the feed time?
Say that again, please.
What methods are useful in preventing your baby from nursing so much that he or she overeats to the point of vomiting, even when you limit the feed time?
Sometimes that happens with moms who have like an overactive letdown or a very forceful letdown. So what that means is in the beginning, when the baby starts to suckle at the breast, that initiates stimulates the reflex to let the milk down. So what happens is sometimes some moms are just very, very, very strong producers, and the milk can be forceful, and the baby takes in so much air while gulping. So what I usually tell my moms is to recline back just a little bit, and even putting the baby in the football hold where they're more in an upright sitting position, and this kind of alleviates that. So it's not, so gravity kind of takes hold, and so the milk is not so forceful coming out. And that does tend to work. So just, but yeah, let me know if there's anything I can do with help with positioning or latch.
When should I introduce a bottle?
That's really just, a personal preference and a personal decision. We usually tell you probably wait. It's best to wait for after the first 1 to 2 weeks, just so breast milk and breastfeeding can get well established. So your body knows how much you need to produce, how much baby needs, and then there's no sort of nipple confusion. So I'd wait for about a week or 2.
Do you visit all new moms after they deliver?
I do, unless I'm here Monday through Friday and on call on Saturdays. So as long as I'm here, I see all moms. And if I don't have a chance to see them like on the weekends or if they deliver during the night, I usually follow up with them for a private phone call just to check on the weight, see how breastfeeding is doing, offer a consult if they need to come in. But yes, I do.
What are some of the most common issues you see with first-time breastfeeding moms?
Probably it's just their lack of confidence as far as if they're going to be able to feed their baby enough, if their baby's getting enough. They just don't have the confidence, I think, just to realize that they're doing everything that they can for this baby and that they're doing a great job and that this is normal just for second day of life. They get fussy and want to eat all the time. They kind of question if they have enough milk, if they're going to be able to produce. So I think probably the confidence factor is probably the number one.
What do you suggest I do with a baby that gets upset and pretty much wrecks the entire feeding session?
Try to figure out why. Like just troubleshoot on, is baby gassy? Is the latch not right? Is she not comfortable? Change up different positions. You just kind of have to just try to figure out your baby and just kind of make it work. Sometimes you may have to pump a little bit, just settle them down, give them a little express breast milk first. That kind of does the trick. Just if they're too mad and too fussy, a lot of times they won't latch on. So you just maybe have to calm them down, do some other soothing techniques, and then just keep trying, keep at it.
I know you answered this in the beginning for those who are just joining. How often should you breastfeed?
Usually 8 or more times in a 24-hour period is how often you should, in that whole day. But really the main thing is to nurse on demand, nurse on feeding cues. So when that baby looks hungry and starts rooting or showing signs of hunger, just nurse. Because I find that moms that want to put babies on a schedule and be real rigid with it, those are less likely to nurse for as long as they could. because they just get so questioning their milk supply and if baby's getting enough. But if you just nurse baby on demand, then rest assured the baby will get exactly what she needs.
Again, also, can you reiterate, are there any medications that a woman should stop taking?
I mean, all medications pass through the breast milk. So, I mean, that's really kind of hard to answer in one answer. If there's a specific medication that you have that you'd like me to look up, we have a great book that's, just a pharmacology-based book for breastfeeding only. So just give me a call and I can definitely look up that medication for you.
Okay, last question.
Mm-hmm.
What is the best way to contact you to set up a consult, and what is the cost?
There's no cost, and probably the best way is to call me directly in my office, which is 985-230-6415. All right. Thank you so much for joining us today. We appreciate it. Happy World Breastfeeding Week.